Hi everybody, I'm Ashton Hofstead. I'm a nurse practitioner at Benefis Gastroenterology. Yes, most if not all commercial insurances as well as Medicare and Medicaid do cover colonoscopy as a preventative screening. There is no direct link between irritable bowel syndrome and increased risk of colorectal cancer. So the screening recommendations would still be the same for patients with irritable bowel syndrome. So colon cancer is genetic or hereditary, and the recommendations for screening vary from patient to patient. Say, if you had both parents had early onset colon cancer or multiple siblings, things like that. But for the most part, if you have a first degree relative, like a parent or sibling that was diagnosed with colon cancer before the age of 60, then we recommend that you have your initial screening starting at age 40 rather than age 45. So some of the most common signs or symptoms of colon cancer would be change in bowel habits, blood in the stool, persistent abdominal pain that is not going away, unexplained weight loss. And basically, if you're having any of those symptoms, then you should see either a primary care provider or a GI specialist to have that evaluated further. For the most part, primary care is a really good place to start. Your primary care provider usually knows you well, and they can kind of go over all of the problems that you're having. And then if they feel that further investigation with a specialist is warranted, then they can send a referral for that. But if you are wanting to go directly to a GI specialist, we are always happy to see you here at Benefis.
I'm Dr. Thomas Attaway. I work here at Benefis in the Department of Gastroenterology, and we specialize in taking care of gastrointestinal problems, and we do a lot of the colon cancer screening, particularly the screening colonoscopies. I would say yes, it is. If you've had 2 negative colonoscopies, you're probably in a lower risk category. And if you prefer to convert over to, stool testing, I think that would be entirely reasonable to do that. Things that might make you higher than usual risk for having colon cancer. One is that if you're a man versus a woman, you have a slightly higher risk. But everybody is at risk. Women have a 1 in 25 chance of getting colon cancer in their lifetime. Men have about a 1 in 22 chance, so slightly higher. Age, the older you get, the more likely you are to develop colon cancer. There are some other risk factors that are not modifiable, like mainly family history. You can't do anything about the family you were born into, but family history is definitely important. For instance, if you have a single family member with colon cancer at age less than 60, you have about a 10% chance as opposed to the 4.5% of someone who's not got a family history. If you have 2 family members, that jumps up to about 17%. And then there are some people who have what they call high-risk colon cancer syndromes, like polyposis, where they develop many, many polyps, and they have a very high risk of developing colon cancer, maybe 40%, maybe 80% by the time they're 40 or 50. Most risk factors are not going to be modifiable, but there are a few things you can do to lower your risk of colon cancer. Things like obesity increases your risk of colon cancer, excessive alcohol use, and smoking. Diets rich in meat and fat also put you at an increased risk for colon cancer. Those things you can change to change your risk to some degree. And the specific screening tests that are most commonly used are, one is just fecal occult blood, and that's just testing your stool with a chemical test for blood. And that has been shown in studies to make a significant difference. It drops your risk of getting colon cancer by about 20%, or dying from colon cancer by about 20%. Then we have the fecal immunochemical test, and that's a little better. It's about, because it's specific for human hemoglobin, so you don't have to worry about what you're eating and drinking during the testing, and that'll drop your risk of dying from colon cancer about 30%. And it's about 80% sensitive at picking up cancers, so it's a very good test. There's really good data about mortality with those two tests. There's less good data about the Cologuard, which is kind of the new kid on the block. We do that every 3 years is the current recommendation. Supposedly it's up to 92% sensitive for detecting colon cancer, but in younger people it's not quite as sensitive as that, maybe about 80%. They don't have mortality data to show that it actually prevents people from dying with the Cologuard, however, unlike the other two tests. And none of these tests are real good at picking up polyps, you know, the precancerous stage. Colonoscopy is the gold standard, and it's been shown to prevent up to 90% of colon cancer in some studies. I think the average is preventing colon cancer mortality about 60%. And as opposed to diagnostic colonoscopy, when you have symptoms, the chance that you're going to die of colon cancer is reduced somewhat, but maybe 30%, but not quite as much. And colonoscopy is overall regarded as the best thing, because it's colonoscopy. If you have a positive test with anything else, you're going to end up needing a colonoscopy, because we want to go in there and, one, make the diagnosis, and two, take out any other polyps we see. And whereas when we use colonoscopy as a screening test, we're going to be taking out the polyps, and so you don't have to worry about the polyps later becoming cancer. So the overall results are probably better. The other thing that's nice about colonoscopy is that it's longer intervals between exams. Like, for instance, the occult blood would be recommended yearly. The fecal immunochemical test is every 1 to 2 years. The Cologuard is every 3 years, but colonoscopy, if you have a negative exam, it's 10 years. And then we modify those recommendations depending on what we find. If we find polyps or large polyps, then you're going to be getting colonoscopy more frequently than that. Then if you are an average risk individual, any of these methods is suitable. If you're a high risk individual, like you have a significant family history, you've had polyps or cancers before, polyps or colon cancer, I should say, then you should probably stick with colonoscopy and not.
You do not need to have a referral in order to be seen by one of our GI specialists here at Benefis. So if you are interested in making an appointment, you can call 406-731-8360. Thank you.